All right, I want to talk about Medicare for all and healthcare in general. Healthcare is one issue that voters vote on like crazy. It's always either number one or number two on top of the list of things that voters are the most concerned about. So I want to talk about it. I want to talk about Medicare for all. Bernie is the one who kind of is the vanguard of that. He started talking about that and galvanized the whole nation around that idea. Right now it polls really well. Medicare for all is anywhere from the mid 60s to the low 70s% of Americans agree with it. At this point, more Republicans agree with it than disagree with it. So it polls really well. And because it polls really well, you'll find that a lot of these other candidates, i.e. Kamala Harris or Pete Buttigieg or Beto O'Rourke, even Elizabeth Warren, they kind of co-opt that verbiage, right? Medicare for all. They take it and they make it mean whatever the hell they want it to mean. So that's why I'm doing this piece, because I want to be clear. Elizabeth Warren and Bernie aren't the same as far as their views on Medicare for all. They're just not. Bernie and none of the candidates are really about what Bernie's talking about. They'll co-opt the language again because it's a winning political talking point. But they don't mean what they say, and I want to explain the difference to you. All right.
Take our black asses out of here. Won't you take our black asses out of here?
So first, let's talk about the history of Medicare. Medicare was started in the 1960s by Lyndon Baines Johnson as part of his Great Society program. Now, that program was a collection of policies that sought to uplift people out of poverty. I would say maybe the one of the most important parts of that Great Society was Medicare. Medicare started off as a program that was supposed to give health care, government-funded health care to elderly people at a certain cutoff age, right? Currently, the cutoff age is 65, or the cut-on age, if you will. The age that you're allowed to get the care, the Medicare. It's 65 now. Not a lot of people know this, but Medicare, the age that you're eligible for it was supposed to go down over years, right? And eventually, it was supposed to give what we know as universal care. So the age is supposed to come down from 65 to maybe 40 to, just keeps going down until everyone's covered. Now, that program was started in the 1960s, and that never happened. Why? Because the Democrats strongly moved to the right as far as healthcare is concerned. Further proof of the fact that the Democrats moved to the right and they started listening to the Republicans and started, as far as their views on healthcare, they changed them and moved to the right. And my proof of that is Obama. In 2010, he fought for it relentlessly and was drugged through the political hay, or the mud, probably is a better word to say. He gave up a lot of political capital fighting for a Republican idea. Obamacare is an individual mandate. It mandates individuals to purchase healthcare from the private market. In the 1990s, the Heritage Foundation, which is a right-wing think tank, as a Koch brothers funded think tank, wrote policy papers in support of that idea of an individual mandate. Whereas the Democrats, their classical idea has always been universal health care for everybody. And the Heritage Foundation and the Republicans came up with a response. Okay, let's not do that. No. We can't have corporations paying their fair share in order to help people get health care. We don't want that. No, not at all. We don't want that. No, we don't want that. Let's do this individual mandate where we mandate that individuals pay a private entity that wants to make profit. Why would you mandate that individuals pay a private entity that's seeking to make profit off of healthcare? So in other words, you're hurt. I'm going to find a reason to not cure you so that I can keep all the money that you paid in your premium so that we can pat the bottom line and pay our CEOs millions and millions of dollars. So it's by its very nature, it's immoral. Let's continue talking about cost. The average family of about 3 or 4 people pay about $29,000 a year on healthcare. Medicare for All eliminates premiums, which are the main drivers of that cost, right? Premiums, deductibles, things of that nature. Medicare for All does away with all of that. Now let's talk about, so that you're saving money as far as premiums are concerned. Now let's talk about taxes. Bernie says it straight up. Your public taxes will go up under Medicare for All. For most people, your public taxes will go up. Now, what do I mean when I say public taxes? I mean money that you have to pay to the government, that will go up. However, the part that they always leave out, there's something called a private tax. It's probably a term that a lot of people don't know. Where that term comes from, the reason I know that term is because when the Republicans were going after Obamacare and they got all the way up to the Supreme Court, the Republicans were trying to claim that the individual mandate was unconstitutional because it was literally an undue burden or a forcing people to purchase something, right? Which you can understand why they'd say that's unconstitutional. But the reason why Obamacare is still around today is because the Supreme Court determined that healthcare is a cost you have to pay. In the same way that you pay your taxes because you have to live in a society, you have to pay your taxes, you have to pay healthcare costs. Why? Because you gotta live and stuff, right? So that's the only reason Obamacare is still around, because they determined that the premiums that you're paying, that mandate forces you to pay to those private insurance companies, is in effect a tax. And it is because you have to pay it to live. We have two types of taxes, public tax and private tax. Your public taxes will go up under Medicare for All. Like I said, your public taxes will go up, but you're not paying your premiums, you're not paying your deductibles. That $24,000, the $29,000 a year that the average family of 3 or 4 is paying towards those private taxes will go away. And do you think your taxes are going to go up by $24,000 or $29,000? The average family of 3 or 4? No, it won't. So when they say that the costs are going to go up, you're going to pay more taxes. Remember, two types of taxes: private tax, public tax. Your private tax will be eliminated, and that's always going to be a more expensive tax. Why? Because they're taking money to pad bottom lines, to pay for advertising within their private insurance company, to pay a CEO millions of dollars. It'll always be more than any other public tax, because the public tax is only going to pay for your care. So don't let anybody scare you out of the cost associated with Medicare for All. Yes, your public tax will go up, but your private tax will be eliminated, and the private tax is always more than any public tax going to be. That's the type of crap they do. But then Obama passed the bill or whatever, right? With no Republican votes, by the way, but it's a Republican idea. We move so far to the right on so many issues, especially economic issues in this country. Medicare for All would literally just do what Medicare was supposed to do from the jump. It was supposed to it would drop the age of your eligibility for Medicare down to 0 so that everyone gets health care. There was also a program under the Great Society that was supposed to start called Medicaid, which was for kids to get free health care. And both those programs, Medicare and Medicaid, were supposed to, Medicare goes up, you get covered more, cover the older kids, and Medicare goes down, cover the younger adults until everybody's covered. That was the original plan, but anyway, so that's just history. I want to talk about these fake-ass Democrats that are in the primary right now that are claiming to be for Medicare for All, but they're just stealing the moniker and doing their own nonsense bullshit half measure. I'm going to give you a great example. Mayor Pete Buttigieg, the Booty Judge, from motherfucking South Bend, Indiana, where he did some crazy stuff with some racist shit, I'll say. But I'll cover that another time. Mayor Pete Buttigieg is out here talking about Medicare for all who want it. Because, Americans love choice. And, they don't want to be bogged down with government control of everything. No. Now, what that is basically a public option. Now, a public option is something that you put into the framework of Obamacare. Like I said with Obamacare, you have a individual mandate mandating people to buy insurance, and you expand Medicare. You expand Medicaid so more people can get health care. The public option, it operates somewhere within that framework, where it basically gives you the option to buy into Medicare. Or, you'll say, you're in the market and you're saying, I can't afford any of these private plans, so let me just do Medicare, right? So it basically gives you an option where the private companies are still providing healthcare. They're the main driver of healthcare in this country, but you have a little public option on the side, right? With a little extra government funding, but nothing too crazy. We don't want to raise those wealthy people's taxes too much now, don't we? You fucking booty judge. The issue with the public option is that what it does, it creates a two-tier system. I'll explain. Under Obamacare, like I said, you're mandated to buy from private insurance. Now, what will happen if with a public option, the private insurance will only accept the healthy people. Why? Because the healthy people will keep paying their premiums, and they're not going to take anything away from that money because they're healthy. So what will happen to the public system under that framework? The public system will get bogged down by unhealthy people. And then what will happen? it'll become less solvent. And then what happens naturally as we live in this society? We see this all the time. What do they say? Republicans, even Democrats. Oh, that program is too expensive and it's not working well because it's not funded. It's not because the public entity providing that service is bad. That's not the case. The case is that it's underfunded, and wealthy insurance companies, what they're doing, they're offsetting their costs. The cost that they said they want to provide healthcare, right? But they're offsetting the sick people who need it the most so that they can be on the government plan, and then the government plan is going to fail because it's not funded enough for all these fucking sick people. It's all about spreading around risk. That's the point of insurance. But what they're going to do is take the healthy people so they have the least amount of risk, and they're going to put all the sick people disproportionately on the public plan so that the plan could go belly up. And so that if they want to cut it, they can legitimately say, oh, look at the bad outcomes it's having. Let's cut it. That's the bullshit that Republicans do, and they've convinced Democrats to play the same goddamn stupid game too. When people just need help, right? It's as simple as that. In most developed countries, you go in, oh shit, I broke my foot. You fix your shit, you get the fuck out. Whereas in this country, we have but anyway, that's another thing. Also, Mayor Pete Buttigieg is a fucking liar, because earlier this year, there's a clip of him talking about how the Medicare for all is the moderate position, which is actually kind of true. If you look at the system that they have in the UK, the NHS, the National Healthcare System, they have public doctors. So in other words, the doctors work for the government, and the government funds the whole program. So everything is funded by the government. Whereas Medicare for all, Bernie's bill, allows for you can have a private hospital, you can have sure. But the government pays everything. But you have your private entity, the government pays everything. So the middle position, and I agree with Pete Buttigieg back early this year when he said that Medicare for all is the moderate position, because it's not public everything. The government ain't going to run all the hospitals. No, private entities will run everything, but the government will pay for everything. And now he's changing his whole disposition, and he's saying, oh, how are you going to pay for it? And, you got to give Americans an option. Let's talk about having an option with regards to healthcare and how ridiculous that is. You telling me that, I want an option as to what car I want to buy. Sure, that's your car, your jeans, option. Have all the options. But would you tell somebody that they need, would you say, hey, give them an option as to whether or not they need a fire station in their neighborhood? Would you tell give me an option as to whether I need whether I need cops in my neighborhood? No, these are things that should be universally guaranteed throughout the country. So should healthcare. And what is choice under healthcare? Okay, I want this plan that covers just my organs or my liver and not my lungs. What is when I'm sick, I need help. That's all it is. There's no fucking choice to consider when you're talking about healthcare. It's the dumbest shit ever. But Americans kind of have this. I would call it it's kind of like a fetishization with choice and with having freedom and all of these things. If you have to make a decision as to like what hospital you can go to or can't go to after you've just been shot, because you have to think about your insurance, is that freedom? Or you have a heart ailment you have to deal with. Oh, I can't go to that hospital, I have to go to is that freedom? That's the choice you want to have? How about every doctor is covered? I can go to any doctor. If I have any issue, I can go to any hospital. That's freedom. To me, that's freedom. But again, the reason I'm worried about this Buttigieg boy is because I think that his talking points about having choice, Medicare if you want, or Medicare for all who want it, whatever the hell his dumb shit is, I feel like that'll resonate with Americans. But if you explain to them a little bit, wait, like what choice do I really want with healthcare? I don't want choice. I want the choice to go wherever I want to get my healthcare, and that's what Medicare for all does. Whereas keeping these private insurance companies in power, they're going to want to direct where they're getting their money from and how they're getting their money. And they want to have networks. They want to have all this bullshit to make life harder and make life more complicated for people who just are sick and need help. It's the sickest shit ever. But that's my piece today. And fuck a Buttigieg. Fuck a Biden. Fuck a Joe Biden. Motherfucker Joe Biden. I like Elizabeth Warren still, but she's faltering a little on the issue of Medicare for all. And I'm so disappointed in Tulsi Gabbard because she's falling for the right-wing talking points, and I don't support her anymore. To be G with you, I don't support her because if you're not for Medicare for all the way Bernie's for it, I fuck out of here.
Take our black asses out of here. Won't you take our black asses out of here? Won't you come save us, catch up and